The number of prescriptions I'm doing for antihistamines and steroid nasal sprays is crazy. And the other day I had a patient that used one of their hay fever medications in such a dangerous way, I thought, right, I need to make this video. And as a doctor who has a husband and a young daughter who also suffers from hay fever, I really understand how debilitating and irritating it can be. So in this video, we're going to cover what you can do to help your hay fever symptoms without having to use medications. And if you do need to use medications, where to start off from, what to add in next, depending on your symptoms. And whilst we're on that topic, the thing that I need to teach you is how to use your steroid nasal spray properly, because unfortunately a lot of you do not know how to use it properly. So I'm going to show you how to use that today. In addition to that, we're going to cover if consuming honey from your local community can help with your hay fever symptoms, and if hay fever jabs that we see marketed on the high street can actually help your hay fever, and what are the risks and benefits. And also, if you've tried all the different treatments for hay fever and you're still very symptomatic, what else can you do? So let's get right into it. So hay fever is a type of allergy towards pollen, and pollen is essentially a bit like the flower's sperm. It gets dispersed into the atmosphere and then it goes and lands on different flowers and pollinates them, and that's kind of how they reproduce. But when they land on our nasal passages and in our eyes, some of us, our immune system is tuned in such a way that it sees it as a threat and it starts reacting towards it. So it gives you watery eyes to flush out the pollen. It gives you watery, itchy nose and sneezing to flush out the pollen from your system. So that's the reason why you're having these symptoms. Now, if we understand that hay fever is as a result of our exposure to pollen, you'll understand that controlling your exposure to pollen can really help your symptoms. So I'm going to go into really quick do's and don'ts to help you with this. First thing is to download an app that allows you to look at the pollen forecast. On days that are humid and windy and hot are the days that the pollen count will be very high. So just knowing what the pollen count is going to be for that day can help you prepare for your day ahead. Now, a lot of people don't know this, but if you put some Vaseline around your nostrils and also around your eyes as well, they can help trap the pollen from going into your eyes and into your nose. So if you do find that you need to go outside and you want to control it that way, then you can do that. And other patients find that they wear these wraparound glasses that reduce the amount of pollen that gets into their eyes, or actually a wide brimmed hat that helps the pollen falling down into your face. So if you've gone outdoors, the pollen is going to settle onto your hair, onto your clothing. So when you come home, it's really important to take off your clothing and put it in the wash. You might also want to shower as well. That also goes for your pets that are outside. So imagine your dog goes out and has a good roll around in the field. They're going to be covered in pollen. So if you're bringing them home, then you're going to bring the pollen home. So you might want to give them a quick wash as well. And the last two is that you should keep your windows and doors closed. We want to reduce the amount of pollen that's coming into our house. And on that note, you can also vacuum regularly and use a damp cloth to dust to remove the pollen from the surfaces of our home. If you do have the budget to, you might also want to get an air purifier that has a HEPA filter. These filters can filter out pollen particles in the air. Now to some important don'ts that can make a huge difference to how much you suffer with your hay fever. If you own a garden, then do not cut grass or do not lay on grass. Save that task for somebody else. And although an unpopular opinion, I don't really like fresh flowers. I feel like it's just a weird concept to have flowers that you cut and bring into your home that you put in a vase and that wilts after about 2 weeks and that you throw in the bin. Like I said, that might be an unpopular opinion. But if you're a hay fever sufferer, you shouldn't be bringing fresh flowers into the home. They're going to have pollen and increase your pollen exposure in the house. You can opt for like plastic versions. Now, don't dry your clothes outdoors. Whilst they're drying outdoors, they're going to have pollen landing on them. You're going to bring the clothes home and wear them, and you're going to be exposed to pollen. And also, did you know that if you are a smoker, then it makes your hay fever symptoms worse? So it might be a good idea to give up if your hay fever is really troublesome. So what can we do if we have hay fever? Say that you've done those do's and don'ts that I've said and you're kind of still suffering and it's impacting the quality of your day-to-day life. This is where you need to start off. The first thing to do is to go to a pharmacy or a supermarket and buy an antihistamine tablet. Now, in hay fever, we have these cells called mast cells, and when they're in contact with pollen, they release something called histamine, and it's that molecule that actually gives you those symptoms. So if you take an antihistamine, it prevents the histamine from being released and reduces the symptoms that you have. Now, when you are buying antihistamines, there's a really important thing that you need to note, and that is to make sure if the antihistamine that you're buying, is it drowsy or non-drowsy? So there are two different versions, and if you are driving or operating heavy machinery, it's really important for you to know which one that you're buying. Now, for a lot of people, having just an oral antihistamine is all that they need. They take one in the morning once a day and it sorts them out. But if you're still having symptoms, especially runny and itchy nose, this is what you need to do. You need to get yourself a steroid nasal spray. You can buy these over the counter. Pharmacists will tell you how often you need to use yours depending on the brand that you buy. And what this does is it dampens down the inflammation that's caused by hay fever in your nasal passages and sinuses. But the reason why a lot of my patients don't reap the benefits of this product is because they haven't been shown how to use it properly. So I'm going to show you really quickly how to use this, and it should revolutionize your hay fever control. Gently blow your nose, shake the container and look down. And use your opposite hand to your opposite nostril. Squeeze once or maybe twice depending on the dose of the product that you have. And gently breathe through your nose. Make sure that you don't sniff, because all that's going to do is make you swallow the product and it doesn't go where it needs to. Now, if you're still having symptoms despite using an oral antihistamine and your steroid nasal spray, then you need to speak to your doctor who can help escalate your treatment for you. But if you are having eye symptoms, then you can buy over-the-counter allergy eye drops to help with those. But if your predominant issue is itchy and runny nose and congestion still, then a doctor may want to up you to a steroid nasal spray that also has an antihistamine in there that can work better for some people. And that would mean that you wouldn't have to take the oral antihistamine. If you are asthmatic, then there are different versions of the nasal spray that they can give to help with your symptoms. Now, my patients ask me that there is this saying that goes around that if you consume honey from your local community, so essentially honey that's been in contact with the pollen from where you live, then it kind of like desensitizes your immune system and helps with your hay fever symptoms. Now, with a lot of things in medicine, it's one of those things that have been researched a little bit and there is no evidence to support it, but if you find that you have done it and it helps your symptoms, then by all means continue to do so. My pet peeve is actually when I see hay fever jabs being advertised. Now, what are these? Hay fever jabs are essentially a big dose of steroid that's injected into one of your muscles. It was actually offered by the NHS many years ago. However, further research has shown that the risks from this treatment outweighs the benefits that it gives you. For that reason, it's no longer licensed to be used in the UK. However, it is being offered by a few people on the high street as off license, so be aware. Steroid injections can work quite well because they dampen down the immune system, and when your immune system is dampened, your hay fever symptoms get better. So actually it works quite well. But if you think about that concept, the risks that you're exposed to as a result of that doesn't make this treatment worth it. So what are the risks that are involved with steroid injections? Well, it can increase your blood pressure, it can lower your mood. If you use it long enough, it can start thinning your bones. It can make you susceptible to infections. If you're diabetic, it will cause your blood sugars to go up. And also in rare cases, it can cause a bone in your hip to die. That's called femoral necrosis. So as you can see, the benefits do not justify the risks. So avoid if you see anyone advertising this for you. So you're probably thinking, Ezgi, what I've done is I've done the do's and don'ts. I've done my antihistamines and my steroid nasal sprays, and the GP has given me loads of other sprays and solutions to use. I'm still suffering. What can we do? Well, at this point, you can be referred for some sort of immunotherapy. What this involves is small injections of pollen into your body to desensitize your immune system. It tells your immune system to be like, whoa, 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 stop. This is not a threat. It's okay. You don't have to react to this. And a lot of patients feel that this treatment works really well, and the effects of the treatment can last quite a number of years, and it might mean that you don't need to use any steroid sprays or antihistamines for a long while. So that's what you should be opting for, not these hay fever jabs. So anyways, that's hay fever and how to treat it in a nutshell. I really hope that this video was useful for you. This is discussions that I have with my patients every day. If you like the video, just give it a thumbs up, and don't forget to share it with anyone who also suffers from hay fever. Subscribe for more videos, and I'll see you in another one. Bye.